Hi, I'm Dr. Gregory Davis in Chico, California. I'd like to take a few minutes to talk to you about PMS symptoms. If you're like a lot of my patients and you're suffering from PMS, you would like to find some answers. So what we're going to do today is we're going to take you through some simple solutions to alleviate your PMS symptoms. Now, let's look at PMS. If we first look at your menstrual cycle and you have a period here and you have a period here. Now, it may vary. Some people may have 21-day cycles. Some ladies may have 28 to 30 days. And by the way, anything between 21 and 34 days is considered normal. So what happens is a lady has a period here, and what actually triggers that period and the hormones related to that is that right before your period starts, so the day before, your estrogen level's at its absolute lowest. And so that's important because that sends a signal to your brain. Your brain goes, hey, we don't have enough estrogen down here. So your brain says, okay, we got to find some estrogen. So your brain stimulates some hormones to pick an egg in your ovary. You have 300,000 or 400,000 eggs in each ovary. One of those gets picked. I guess it's kind of like the lottery, but one of them gets picked. As that egg gets picked, it starts to make estrogen, and your estrogen level starts to come up. Now, the reason that some ladies have a 3-day period is because their ovary is faster at finding that egg, and so their estrogen level increases, and it gets to this magic point, and their period stops. So when you increase your estrogen, that's what stops your period. So if a lady has a 3-day period, her estrogen's faster off the line. If she has a 7-day period, well, it's just taking her ovary a little bit longer to kind of get off the launching pad, and eventually the estrogen starts to come up. So as the estrogen starts to come up, it gets up here to ovulation. When we get to ovulation, your estrogen level's at its absolute peak. Now, what happens in a normal cycle is that this estrogen level starts to come back down, and of course we're going to have another period here. Right at ovulation, your progesterone starts to come up, and so you're making progesterone. So you're making progesterone for these last 2 weeks of your cycle. So what happens is that your body continues to make progesterone waiting and thinking you're going to get pregnant every month. When there's no pregnancy hormone floating around in your bloodstream, then what happens is that the corpus luteum, the guy that's making the progesterone, goes, okay, we're out of here. So when you get rid of your progesterone, your lining inside your uterus just kind of separates, you start to bleed, and then you have a period, and then your progesterone drops, and now we're right back here for the next period. So what PMS symptoms are is the fact that your estrogen level gets up here, and for whatever reason, as your estrogen comes up, you're not quite getting up here to ovulation. So your estrogen's a little bit lower, and then because the egg didn't ovulate, it starts to drop, and it just goes abruptly down. And so what happens is that your estrogen level drops really fast, and then it drops below the line. So this line we'll call normal. So when your estrogen's above this line, you're feeling good. Everybody's happy. When your estrogen's below this line, you're not doing well. So this period right below, or this time period right below your the line is called PMS. So the PMS is just basically low estrogen for however many days before your period. For some ladies that have PMS for 1 day, well, it's just dropping down 1 day before. Some ladies may have 3, 4, 5 days. So what happens is that when you don't quite reach ovulation and you don't quite make enough estrogen, then your estrogen level drops rapidly. You get PMS symptoms. Now, what are the signs of PMS? Well, it's interesting. They're the exact same symptoms ladies can get when they go through the menopause. You may get hot flashes, you may get night sweats, you may get mood swings, irritability, headache, anger, cravings, trouble sleeping, vaginal dryness. You may get a lot of those same symptoms, and you just don't feel good during that time. So what happens is that today a lot of people, when they kind of get depressed during that time period, and so there's a classification for that, and so people get put on an antidepressant. Well, the frustrating thing is that an antidepressant is kind of a Band-Aid. That's not really the source of the problem. The source of the problem is your estrogen level is low. All you got to do is just raise this estrogen during this period, and you're going to do great. So how do we treat it? It's a very simple solution. We take a natural plant-based bioidentical estrogen, And you can pick that up at any pharmacy. It's a prescription. And they come in pills and patches and creams and gels and sprays. There's bound to be some estrogen that your insurance is going to cover. So, for example, if I give you a Vivel Dot patch, an estrogen patch, and right when you start to get your PMS symptoms and you start to notice you're getting a little irritable, or your husband or boyfriend or friends or family tell you, you know what, I think you need to put your patch on. Then you put your patch on right when you're starting to get your symptoms. That patch starts to work in about 4 hours. And guess what? You don't go down here. Your estrogen level stays up. You feel good. You're doing great. Your period then starts, and on this, like the second day of your period, you take the patch off and then you're good. So every month you just have to remember to take your estrogen patch or estrogen pills, whatever estrogen you choose to use. You just need to take it during that time period. And that will bring you up and you're going to do fine. It's interesting. When you look at a snapshot of what's happening right here, you've got low estrogen and you got high progesterone. And so that is never a good thing. If you look at what happens to ladies who get postpartum depression, I'm kind of branching off here for a second, but postpartum depression, when you look at what happens, the lady's just had a baby, her ovaries aren't ovulating, she's not making any estrogen, she's still got lots of progesterone floating around in her bloodstream. Now she's making the breast hormone, the prolactin, which is an anti-estrogen, so that's suppressing your estrogen. So, and she is in a classic situation for like PMS. So if somebody gets postpartum depression, it's usually, and it's interesting, I found in my practice, is it's usually ladies who've had a history of PMS. They're in their 30s, certainly mid to late 30s, and so they're at higher risk for postpartum depression. So the key thing is that if you have a history of PMS, you're in your mid to late 30s and you're going to be getting pregnant, you just want to keep an eye out for the fact that in that day or two after you deliver, if you start to get the postpartum blues, how are we going to treat that? It's very simple. We're going to give you a natural plant-based estrogen. You put that patch on, and that patch is okay for you to take. It's a very low dose of a natural estrogen. It's going to bring that up, your depression is going to go away, and you're going to feel great. Now, just remember, the birth control pills have been approved for somebody to take when they're breastfeeding. It's the high doses of estrogen in birth control pills that may decrease your breast milk. That's a totally different type of estrogen. That's a synthetic estrogen. What we're giving you for your postpartum depression or for your PMS symptoms is a natural low-dose estrogen. It's actually 17 beta-estradiol. That's exactly what your ovaries make. So you're not going to notice any difference. I mean, it's going to be just like your ovaries are working on all cylinders and you're feeling good. So remember, if you have postpartum depression, taking that is going to make a huge difference. I had one of my patients just come in the other day, and after she started to develop the blues after she delivered, I saw her several years ago, and we talked about this. First thing she did, day 2 after delivery, she put on the patch. All of her symptoms went away. She felt fine, and then she was over the hump, and she did well. So I hope that this will help you as you're dealing with your PMS symptoms.